Well, this week we're taking you to Kenya, showing you the work of a volunteer team from Utah.
Yeah, not only did they build a school, but they also did some work in hospitals there. First, ABC4's Brent Hunsaker joins us now with more to tell us about what happened with that situation. Brent?
And I am joined by Jerem Woodbury and Megan Kistner. Both are, I guess you're going into your third year, right?
Yes.
You're just starting your third year.
Exactly.
Third year doctoral students in physical therapy. And they were among a group of about 15 from Rocky Mountain University of Health Professions in Provo who served in Kenyatta and Nairobi hospitals.
Exactly.
And they joined us now to talk about their experiences there on this recent expedition with the Utah-based World of Difference organization. First of all, the original plan before we went there was for you guys to observe, to kind of walk around with your hands in your pockets and just see how the Kenyans worked.
Exactly.
That went out the window real fast.
First day, yeah.
What happened on the first day?
Well, the first day we showed up at the hospital, it was, we had to explain to them after the morning that we were here to shadow and observe as our first clinical rotation. But that didn't really change much. You know, we got hands-on experience. We were able to work with the patients one-on-one and answer questions and talk to the therapist.
Yeah, we see Jay Hall here working in outpatient therapy. We also saw pictures of JC working up in the critical care unit, putting on compression socks.
Yes.
What sort of clinics or operations did you guys work in, and what did you do?
Well, for me personally, I did of what we here in the United States would call respiratory therapy, because there they don't have respiratory therapists, so they're all the physios do that there. So it's a lot of kind of beating on people, for lack of better words. Yes,
Yeah.
exactly, percussion, and seeing a lot of mucus and sputum spit up. So that was interesting. Yeah.
Oh, yeah.
That was an eye-opener.
Yeah.
Definitely.
Where were you working?
I went to a few different units. Every day we went to a different unit to check it out in the hospital. So my first one was a cardiothoracic, which was my first patient. I had to do the exact same thing that we were just talking about, kind of beating on their chest and getting them to cough up some interesting colored stuff and figure out what to do with that.
Okay, enough about the colored stuff.
Yes.
Okay, you guys are now right in the middle of your clinicals here in Utah. Give me a quick compare and contrast between what you saw in Kenya versus what you're doing right now in Utah.
I guess for me personally, I think it's the time constraints. Here, everything's kind of faster. You have to get to your patients and see them all there. It's kind of less rushed, I guess you would say. It's like, we'll get to them when we get to them, you know, kind of thing. But
Yeah, it was very relationship oriented, I think. A lot of the patients they got to know their therapists a lot better, and the therapists were a lot more calm and relaxed up in the hospital. When it went to the outpatient, it was the opposite. They were rushed. They were just trying to get patients in and out and fast as possible. So a lot like here, but it was very different in the sense of the therapists kind of getting to know their patients really well.
And I understand there was a lot of difference between how therapists here in the United States will diagnose or assess a situation versus what they do in Kenya. Kenya was kind of a one-size-fits-all. If you have congestion,
Yes.
there's one treatment. They don't really try to analyze where the congestion is.
Yeah, I noticed that a lot. The first evaluation I was able to do, which was my first complete evaluation ever on a patient, was I kind of wrote up my plan, and my therapist looked at it and he's like, all right, that looks good. And we went back there and did the exact same thing we did for all the other patients.
For all the other patients
So
as
it was
well.
interesting, yeah.
Well, guys, thank you for letting me come along on the expedition.
Yeah.
It was a
Thank
real
you.
privilege to be with you and to see you guys at work. And one thing I want to say is Professor Mark Walker from Rocky Mountain University of Health Professions supervises students in Kenya. He called this a beta test, what they did there, and said it was a very successful one. In fact, so successful, there's talk of the university of making students a permanent addition to Kenyan expeditions with World of Difference Foundation. What's more, they're also considering doing some cooperative ventures, programs with schools in Kenya to improve the training of the therapists there.